It was the MRI that held the answer. Dr. Cook didn't see the bright white dots and dashes that would suggest MS. Instead, a large round object, a mass about the size of a plum, dominated the middle portion of the left side of her brain. Dr. Cook called the patient and told her that the MRI was normal. She came back a couple of days later. He couldn't tell her based on the pictures just what kind of tumor she had. The most common would be a meningioma, a tumor of the tissue that lines the brain. An acoustic neuroma was rare but also possible. This is a slow-growing tumor originating in the tissue that connects the ear to the brain. She was a little young for that. These tumors usually appear in men and women over 40, and they usually cause problems in hearing and balance rather than in vision. Whatever it was, the tumor was so large that it blocked the circulation of the spinal fluid through the brain, causing the nerve to swell. It would have to be removed. Dr. Cook knew the patient didn't have health insurance. He called around to the neurosurgeons he knew, trying to figure out how to get this woman the care she needed. The only answer seemed to be for her to get in through the emergency department. Thanks to a law called the Emergency Medical Treatment and Labor Act, all emergency departments are required to provide stabilizing treatment to any patient who comes in, regardless of insurance status or ability to pay. The care provided isn't free. Patients are billed, but they have to be treated. She went to the emergency department at the hospital, and the mass was removed. The pathologist confirmed that the tumor was an acoustic neuroma. Reading up on this type of growth, the patient noted that hearing loss is a common symptom. She had hearing loss in her left ear, but she had not made a connection between that problem and the one with her eyes. She thought that the constant exposure to the sound from her violin might have caused a little damage. She figured it was just the price of doing what she loved. After the surgery, her hearing didn't change, but the strange starbursts completely disappeared. Straight lines still have the tendency to buckle in her peripheral vision, though. 1:25, 3.5 minutes.